Hi, I'm Dr. Macalik, and you're receiving this video because you received deep cleaning in our office. If you were numbed for today's procedure, please be sure to be careful while you're still numb in that area. We want to make sure that you're not chewing on your lip, tongue, or cheek while you're numb. After the numbness wears off, it's normal to be a little bit sore after today's procedure. Sensitivity, like to cold, is normal, as well as maybe a little bit of discomfort around the gum area. You can take some ibuprofen or whatever you would take for a headache if this does occur. The sensitivity is usually reversible. It's just a matter of how long it takes for that to go away. A desensitizing toothpaste can help when there's cold sensitivity. Make sure you're maintaining good oral hygiene during the healing process, meaning brushing and flossing. This will only expedite your healing. We should have scheduled your next visit. Sometimes that's 6 weeks out, sometimes that might be 3 months out, to evaluate how your body is healing up. It's really important that you stay on top of the next visit to make sure that this procedure doesn't need to be repeated again. Our goal in maintaining gum disease is a lifelong journey, in that gum disease is chronic, but it is treatable. It's not fixable, but it's treatable. Our goal is to make sure that we're maintaining that level of health for you from here on out. Deep cleaning may need to be repeated over time, but our goal is to make sure that we're not allowing that to advance any further than it has already. Slight bleeding around the area is normal over the next couple days. You will notice that your gums are still going to bleed when you're brushing and or flossing. You can even stick to softer foods if you'd like over the next couple days, but make sure that you are drinking lots of water. Those next visits where we see you for your cleaning are called periodontal maintenance visits. And what that means is gum maintenance, making sure that we're maintaining that level of health that we are hoping to achieve and keeping it that way so that things don't progress any further. After today's visit, if you experience any of the following, please give our office a call immediately. If you have prolonged pain, meaning pain that lasts more than 2 to 3 days, or pain that gets worse than it is after the numbness wears off. Any signs of infection like pus or prolonged bleeding where you can't get the bleeding to stop, those would be important times for you to give us a call. Thank you so much, and we look forward to seeing you soon.